going to discuss the lungs. So first the anatomical positions. How to differentiate right lung from left lung, right? So for this we need to understand the borders, anterior, posterior and inferior border. Or that the interior border of a lung is thick, very prominent or thin, while the posterior one is rounded, more or less like a surface, right? So anterior border is thin, posterior border is rounded, and inferior one is this one, inferior border, right? So it has one apex, one base, right? So base is broad surface, base lies on inferiorly, apex is directed upwards. So this one is upper part, this one is the lower part, right? So this is anterior border, this is posterior border. So logically it becomes the lung of left side, right? When coming on to the right lung, similarly we have anterior border which is thin and prominent, posterior border is rounded, right? And base lies inferiorly. Place the base on your palm hand and apex faces upwards, right? So this is right lung. Okay, so it has, both the lungs have two surfaces, right? One is the costal surface. So actually the lungs are surrounded by the ribs, right? So outer surface, this convex surface is costal, where the ribs lies, encloses both the lungs like this, right? So this is the costal surface and this is the mediastinal surface or medial surface, right? So medial surface is concave and mediastinal surface is convex. So we don't place it like this. This can't be medial because this is convex surface, so ribs lies over here, so this should be face outwards, right? So automatically when the outer surface faces outwards, anterior border which is thin becomes anterior and posterior rounded becomes posterior, right? Now medial surface again is divided into two parts. One is the mediastinal surface, one is the vertebral portion, right? So mediastinal surface is the space. What is actually mediastinum? Mediastinum is the space between two lungs, and what lies in the mediastinum? Heart, right? So we have a concave surface which is called mediastinal surface. Posterior to it lies the vertebral portion, where the posterior part of the ribs and the vertebral column lies, right? So medial surface has two parts, mediastinal as well as vertebral parts, right? Now one more thing is important. We have two fissures actually, horizontal, one fissure horizontal which divides the lobe into upper, superior and inferior lobe in both the cases, right? Here also we have two in the right and left, but what happened is we have actually three lobes in case of right. See this lung, so we have one oblique fissure, so one horizontal fissure, right? So it divides it into superior, middle and inferior lobe, right? So right has three lobes, which already mentioned in your books, three lobes, superior, middle and inferior lobe, but it is not always present. So it can't be the distinguishing criteria for right from left, because we are seeing we have only two lobes, only one fissure here in case of left as well as right lung, right? So lobe can't be a differentiating criteria. Now coming on to the left lung, one more thing is important. Towards the left side we have, heart is more towards the left side, so this mediastinal surface, concave surface lodges heart. So we have a cardiac notch present over here, right, in the left lung, and below this notch we have a lingula. Lingula is nothing but prominent margin, tongue-like projection below the cardiac notch. So it is more prominent in this lung, not visible in that. This is the left, and this projection, tongue-like projection below the cardiac notch is called lingula. So lingula is present in case of which lung? Left lung, right? So these are the anatomical positions, anatomical differentiation between right and left lung. So we have this hilum, where the arteries, veins and bronchus passes out inwards and outside from the lung, right? So this is hilum. So hilum obviously, and hilum will face medially of both the lungs, right? So we have different structures present over the hilum, arteries, veins and bronchus. So that will be discussed theoretically. So this is the D-hole demonstration of the lungs. Thank you very much.